Hey, welcome to another video from SkinnyMedic. I have a new product here I think you guys will find pretty interesting. This is a pre-lubricated NPA. So the NPA goes into our patient's nose to protect their airway. This is generally used for someone who is unconscious, semi-conscious, basically someone who can't protect their own airway. I generally say if they can't cough, then you probably need to look at protecting their airway in some sort of fashion. NPA goes into the nose, doesn't hit the gag reflex, so it makes it a little easier for us. The only kind of issue we need to look at is that they have a head injury, but it kind of boils down to, do we need to protect the airway or not? It's a relative contraindication, but anyway, I digress. This is a pre-lubricated NPA, so we don't have to worry about using some kind of water-soluble lubrication there to loosen that little pack. It's already done for us. So this is generally what you're going to find in most kits. You have an NPA here, it looks something like this, and then an extra pack of lubrication. So you got to lube it to put it in because you're going through the sinus cavities, mucous membranes, like that. So you need to use some lubrication to go into the nose. So this is the most packaging. You can see like the direction here is a little bulky. But this one, you only have one package. So you don't have to worry about losing this little pack of lubrication. It's already done. Alright, so we can see on the package here, we do have some directions. That way, in time of stress, if you forget how to insert the NPA, then you have directions clearly printed right here. It's a fairly easy process. We have two tear strips here that we can open up the NPA. They do only come with one size. It's a 28, which generally fits the average adult. This is made for a military age man or woman, so a 28 is generally going to fit all of them. We want to measure from the tip of the nose here, where it's going to be inserted, down to the earlobe here. The easiest way to insert this is to give the patient a pig nose, and you're going to insert the NPA straight down the nostril. Some people make the mistake and they want to kind of come up this way, and this is not the easiest way to do it. The easiest way is to give them a pig nose. You're looking straight down, insert it. You may kind of have to use a twisting motion in a normal patient, but it's inserted. It's there. If for some reason you have an issue and you just cannot get it to pass, maybe they have a deviated septum, maybe some other issues, you can try the other nostril. So insert it, boom. But typically the right side of the nose is larger. One of the changes I noticed here with the Combat Medical NPA versus a normal NPA is you can see the cut. The cut here is straight with the curve of the NPA. The Dynarex one is at an angle. Typically, we tell our students to insert this bevel towards the septum. So when you insert it, this cut here is to the side. Kind of gets a little tricky though when you go to insert it into the other side of the nose. But here, it's dead center. So the opening is going to be right there. To be honest with you, I'm not 100% sure how long-term storage is going to work on this. That's just something we'll have to wait and see. I will say, like the Dynarex here expires, it has an expiration date of 2023. Not sure exactly what expires about it, but that's what, because it's sterile. But anyway, this one expires 2027. Both these are brand new into the shop. So you get a longer shelf life with this one. So I would assume that the lubrication would be just fine until 2027. So I'll put a link down below if you're interested in purchasing this from us, Medical Gear Outfitters. I appreciate it. Thank you guys for watching. You never know when you'll be the first responder. Remember the right gear and the right training.